Limitation there.
There. Okay.
Yeah. I feel
You
limitation
feel?
here.
Okay.
Yeah.
Hard as you can.
Yeah. Yeah.
Look at that.
Yeah.
Okay. I'm gonna do.
Oh, shit.
There we go. Did you guys see that twitch?
Oh, putain.
Exhale all the way out. You good?
Yeah.
Push. Push, 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 push. Feel the difference?
Oh, yeah. Before I was.
Yes. What's up, everybody? Dr. Ranen here. Today we have another special guest. Claude is in with us today. Now, I met Claude some time ago at the gym, and I was quite intrigued by his style of training. And since then, I've been sending him some patients to manage through injury and exercise rehab. But when we talk about Claude's background, he's bodybuilding for about 35 years now. He's been doing personal training for 20 years. And recently he has gone into a hybrid style of training, of bodybuilding and endurance training. So some of the stuff he's done recently is a 5-hour row, a 9-hour ski, and a 52-kilometer marathon. So I said to Claude, you know what? He hasn't come in and actually experienced my treatment, but I've been sending him patients. So because of the endurance work that he's doing, I thought it would be nice to get him in, get him assessed, and help him prepare for his next endurance event. And your next endurance event will be when?
In 3rd of March.
3rd of March, and that will be?
24 hours of the row erg, non-stop.
24 hours on the rower, okay?
Yeah.
So we're gonna get him assessed. We've already done our case history. Claude has mentioned that he has left-sided shoulder pain, right-sided lower back, hip, oblique discomfort. So the shoulder is giving him more issues, and because of the rowing and the skiing, I think we're going to start there and we'll move over to the lower back.
Yes.
Okay.
Thank you.
Oh, by the way, Claude is what I call the PT to PTs. He's the only personal trainer I've seen train other personal trainers.
Yeah.
All right. Let's get both your arms forward for me, please, and up. Any discomfort in your shoulder?
No, it's okay.
Down for me. Again, up. Any discomfort? No.
Not
down.
sure. No.
All right. Let's get this arm up for me, all the way. Any discomfort, or just find lack of range of motion?
Yeah, that's it. Yeah.
That's it.
Yeah.
Okay, and down for me. On this side here, keep your elbow tucked in, turn your arm out. Okay, and relax. This side for me, please, up as high as you can go.
Okay, here I feel now.
Here you feel.
Limitation there.
There, okay.
Yeah.
Down for me. Elbow in and out.
I feel
You
limitation
feel.
here.
Okay,
Yeah.
so there's a loss of active range of motion in abduction and external rotation. Just want to lower this bed. Okay. Leave your arm loose for me, please. Does that feel better, or do you still feel the pain?
No, I feel good. Only a little bit tight there.
At the top.
Yeah, that's it. Otherwise,
Okay, so range of motion is more or less.
yeah. Now I feel good when you
Okay.
turn. Yeah.
All right. Leave your arm loose. Let me move it out. And again, we see quite a good improvement in range of motion.
Feel good, yeah.
Okay, so let's start by checking your impingement test. Okay, leave your shoulder loose. Any impingement there? Any sensitivity?
No.
No?
I feel tight, but I think it's normal here.
Okay. I want you to compare this to this side, okay? Leave your shoulder loose for me. Any discomfort?
Actually, I feel better now. I feel.
Any sensitivity?
Yeah, here.
Here, okay. Opposite side. Push up for me. Any sensitivity?
No, but I feel strong. This.
You feel stronger, yeah? Okay. Make a fist for me. Hold your thumb up. Push up. Good. Thumb down. Drop down a little bit for me. Okay, I just want you to tell me if it's painful or weak.
I feel good. I don't feel pain.
All right, great.
I try to define, okay, it's pain or because I push here. Or
Okay, let's get this arm here. All right.
yeah.
I want you to push back for me. Start slowly and then start pushing harder. As I go harder, go. Great. Push back for me. Start slowly and then go harder as I go harder. Great. Relax for me. Bend your arm. Here. Make a fist. All right. You're going to push up with the elbow. Start slowly and then go harder. Good. Okay. Make a fist. All right. Push your wrist back towards me. Other way, other way.
Yeah, sorry.
Yes, wrist. There we go. Good. Relax. Make a fist. Hold your hand there. Push out for me. Push. Good. Relax. Okay. Let's try this side. Make a fist for me. All right. Push. No, wait.
Sorry.
Push back. Hard as you can.
Yeah. Yeah.
Look at that.
Yeah,
Okay.
you can see.
Lift up for me. Push back. Hard as you can. Look at that. Okay. Bend your elbow for me. Hold. Wait 1 second. There we go. Right. Slowly. Okay. This can give you some discomfort. All right. Push up for me. Don't lift this. Just elbow.
Okay.
Keep your arms straight. Okay.
Yeah.
There we go. Up. Feel like you're trying too hard.
Yeah.
Gives away a little bit.
Yeah.
Make a fist for me. All right. Slowly start pushing out. Don't lean your body.
Yeah.
Just the elbow. Okay. All right. Slowly. Any pain when I do that? Or do you feel weak?
Maybe it's weak. Yeah.
Weak.
Yeah.
Okay. There we go. All right. On your back for me, please. Turn your wrist in, push towards your hip. Push,
This
push.
side?
Yes, go. Great, relax. Push across for me. This way.
Sorry.
Yes, go. And relax. Okay. So what made you want to start changing your training and get into this new style of training?
It's very simple. I meet Milda.
Yes,
She's CrossFitter. And she told me, do you want to train with me 1 week? I'm on the deload week. And me, yes, because I'm all of the first day. I finished. I was like this. But I thought, I was thinking I need to finish because I told her I will finish. So I finished. And after 1 week, something is happening. I feel it. I feel my energy. I feel much better. Then I start to do raw, like 30 minutes, and by myself, 1 hour, and 2 hours, and 3, and 4, and 5. And I catch quickly. So it was the big change for me.
Nice. Turn your wrist in for me. Push towards your hip. Push. Feel like you're trying a little bit too hard.
Yes, I feel weak.
Push across for me. You definitely feel weaker there.
Yeah.
Okay. All right, just bring this hand under your hip for me, please. There we go. Sensitive?
I don't know if it's normal, this. Yes, I feel it.
Yeah? Sensitive, yeah.
Yeah, when you press, yes. Yeah.
Right there. Okay, so that is your supraspinatus tendon. Just behind that, you have your infraspinatus tendon, which is not so sensitive to you.
No.
But this one is, All right.
This, yes.
Okay, so with the shoulder, you obviously have some impingement syndrome. Okay. In a second, we're going to get your shirt off. I just want to have a look at your scapula.
No,
okay, let's get you to sit for me, please. All right. Okay, let's get you to bring your shoulders back for me. 1 second. When's the last time you saw a chiropractor? It's been years?
10 years.
10 years. Okay, so you don't like doing treatment? Oh, you just don't have the time.
No, time I have.
Yeah.
But I like to try to fix by myself.
Okay.
Means if something is wrong, is because training is something is missing.
Yes, correct. Let's bring your shoulders back for me. Okay. Right. Lift your elbows up, arms up, as high as you can go. Go, 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 and down. Okay. Down, down, down. Go again for me. Go, 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 and down. So you'll see on this side, the trap starts taking over very fast. Go for me. Look, compared to here, and down. Okay. All right. One more time. Yep. See the difference? And down. Okay. So your scapula on this side is working much slower than your scapula on the opposite side. Your upper trap is also taking over quite a bit to facilitate that glenohumeral motion or range of motion, all right? So what we're going to do with the shoulder is I'm going to work on the muscles that are in dysfunction, and we're going to reassess. You do have some irritation of the tendon, but your full can, empty can tests are not so much of an issue. The Hawkins-Kennedy test itself as well wasn't so much of an issue. So these tests put maximum tension on the tendon. If the tendon was badly inflamed, we would have elicited a lot of pain in those, or we would have elicited some pain, which we weren't able to do. So I think once I improve the function, I think your exercise rehab will be more effective. So what I think happens in a lot of cases is, let's say, for example, you have an overload on the shoulder. So already left shoulder, non-dominant, less perception of time and space, less proprioception. You get into something where you're either rowing for a long time. Yes, excess. You have an overload mechanism where the brain starts to shut down the motor control of that area to protect it and prevent it from injuring itself. We refer to this as arthrogenic muscle inhibition, okay? Maybe you've been familiar with the term, but sometimes no matter how much of rehab you do, because you haven't improved the motor control neurologically, the rehab doesn't take. This is what I have noticed, okay? So what I do is I open those pathways using the electro stimulation, which is specific to certain nerves that are controlling those muscles, and then we'll reassess, okay? You will see an improvement, you should see an improvement in range of motion and muscle strength, okay? So the rule of thumb is that proprioception is equal to nociception. This means that perception of time and space directly affects pain. If I can improve your joint position sense by improving the muscle strength and range of motion, it should reduce the discomfort you're feeling on the shoulder. Okay? All right? And then we'll go ahead and we'll look at that hip. All right? So let's get you on your side for me, please. I know you don't like needles. You okay? All right, great. So let's get you on your side for me, please. Yes, please. All right. Okay, brother, you're going to hold for me. So how long have you been in the UAE for?
17 years.
17 years,
since 2006.
Since 2006. And you started personal training in 2004, correct?
Yes.
And by that time, you had already been a competitive bodybuilder for a very long time.
Since 95.
When did you stop bodybuilding?
Competing in 2014.
2014. Okay. What made you stop?
Very good question. To be focused in my more in my job. And also competing, it will give me nothing. Only satisfaction or disappointment. So on the end of the day, I'm not looking for my future, so I decided to stop. Because
Bodybuilding for you was just for fun. You were not looking at becoming
no,
Mr. Olympia.
No. Fun.
Okay.
Fun.
Nice. It's very rare that you find people that compete just for fun these days.
Yeah.
Especially in bodybuilding because it's so demanding.
It's more demanding than what you would get. Yeah.
Yeah.
So.
Especially when you need to make weight essentially. You need to cut down your carbs, cut down your body fat. It's not like CrossFit, I guess.
Yeah. It stress your body. Yeah.
All right. So here we're gonna do.
Oh shit!
There we go. Did you guys see that twitch? This is because of hypersensitivity in this area. Claude doesn't like it.
I hate the electricity.
He's not saying no at the moment, so we're gonna continue. We'll see how far we can take him. You good? Done. What's worse, Claude? This here or the last 20 minutes of a long endurance event?
I prefer to do endurance. Honestly, I prefer. You know why? Because I'm controlling the
Yeah?
And I'm enjoying.
Yeah? So you're not enjoying this?
No, because when I'm doing it by myself.
Yeah.
So
we'll teach you how to do it by yourself then.
I like to suffer when I'm putting pain for myself.
Yeah.
So I can control.
So would you say you addicted to pain?
Yeah, my pain.
Yeah. Oh, there we go. So you have a very interesting style of training clients, which is why I started to refer patients to you. Can you tell me a little bit about that style and how it started? Just to give the viewers some context.
Yeah.
Claude is not just doing standard bodybuilding with his clients. He does a lot of range of motion, mobility work, just putting his patients or clients into very awkward positions through load to make them stronger. Can you tell us about how you started doing that?
So when I started doing that, it's when I was 36, my body start to shut down. Start to shut down. So I need to figure out what.
Yeah, let's go.
Yeah. I tried.
Tell me.
Wait. So I need to find the solution why my body start to be tight or this.
Yeah.
So, stimulate. Sorry.
Yeah, this is your lat, okay?
Yeah. So, I try to be focused. So
I'm trying to get you to talk so you forget about it.
I know what you're doing.
It's not working.
I know. So what I did for myself, I reset my body.
Yeah.
And I adjust what it was missing.
What was missing.
Voilà.
Okay.
So now in terms of the clients, when I have clients, I analyze with few questions, of course, what is need to be work, what is compensation, what this. So I start to process and to work on the weakness part of the muscle. Oh, yes. Oh shit, yeah.
Okay, so that's your supraspinatus.
Yes. So it's to rehabilitate the body. Oh putain, I feel it there. Oh.
This is your infraspinatus.
Oh putain.
Okay.
Yeah. Oh.
You're doing good, man.
I'm doing my best. Shit, man. Oh, putain.
This is your axillary nerve. Now, your axillary nerve supplies innervation, muscle strength to the deltoid, teres minor, but it also supplies pain to the anterior lateral shoulder.
And I start to feel this because I'm doing excess of row, excess of ski, excess of everything.
You may feel a muscle twitch here, okay?
Yeah.
Good. All right. So, how you manage your patients, is this basically trial and error from working with patients over a period of time? Is there some standard exercises that you go to?
Yes. For me, on the beginning, I try to be focused with them on the breathing and to understand what they are doing, to apply after that during the exercise. Oh, putain.
So I've seen you work with a few PTs.
Yeah.
Our good friend Andy.
Yes.
You know,
Yes.
You've also worked with him. I've seen you work with Gloria, who I've treated before.
Yeah.
How did you start like working with the PTs?
I start the first client. It was Marco.
Marco, yes.
I think it was almost 10 years ago.
Okay.
He wanted to. He didn't have any injury, but he wanted to improve his back.
Okay.
So he has already very good technique. So, but when he was doing back, everything was pushing through to his shoulders. He was using too much his shoulders. So what I do is to isolate that muscle and to find different angle to target his back.
Yeah.
And after that, people see me on the gym and they ask me they wanted to try. So I think I had almost 50 trainers, 50.
Yes.
Yeah. So some 2 sessions per week, some 1 session, but total it was 50. But in general, it was most for to improve the body part where it was missing, and few people also with the injury. Because the injury, also working with the injury, helped me to work with people who want to improve different body parts. Because it's relative.
So Andy's doing significantly better.
Yeah.
For those of you who've been following my Instagram, you would have seen me work with Andy Bigger or Andy Bell. Andy Bigger, I think he goes by Andy Bigger on Instagram. He's an IFBB pro. He won Arnold, Ohio, and Australia. And he's had several disc injuries, which I helped him from a treatment perspective for, and Claude has helped him from an exercise rehab perspective. And he is significantly better now.
Yeah.
How's that?
How I feel?
Light, mild, or strong?
It's okay.
So here we're doing suprascapular nerve. Where the needles are placed is where the nerve is most superficial to the skin. So people use TENS by applying patches to the skin. The issue is that by the time the impulse passes from the skin through to the peripheral nerve and through to the spinal cord, it loses its effectiveness, okay? So what we like to do is go straight to the peripheral nerve and stimulate it directly. Wonderful. You're going to have a way more profound effect on the nervous system, okay? Too strong?
No.
You good? All right, so this is a lower frequency, but a longer duration. The first stimulation we do, it opens up your motor control pathways. And the second stimulation is to solidify those motor control pathways.
Okay, interesting,
right? Yeah. So I do this for a range of different injuries, disc injuries. The gentleman that just left, he was in for a lumbar disc injury, which is causing quite a bit of sciatica. When he came through, he had motor deficit, loss of reflex. I worked on desensitizing the sciatic nerve, and he had motor control, which came back almost immediately, better reflex. So a lot of what I do is to work around the nervous system and how the nervous system deals with pain and biomechanical dysfunction.
Okay.
Once we can reduce or subdue the nervous system and its effects on the biomechanical system, then we can jump onto the injury itself.
I understand.
Okay?
Yeah.
Previously, what I was doing is if a patient came through with a shoulder issue and I felt like, okay, it's coming from the supraspinatus tendon, I'd go straight to the supraspinatus tendon and start working. What I found is these patients, they may get better faster because you're working on the area of injury, but ultimately they come back faster.
Yeah, understand.
Okay?
Yeah.
If we improve function first and then address the injury, then there's less chance of them returning.
Yeah.
Okay?
Yeah. Interesting. Yeah.
So, after this, I just want to work on your trap, okay? Your trap's tightening up. Basically, your trap superior is tightening up, trying to lift the shoulder because you are not working so well between like 60 to 120 degrees of abduction, okay?
Yeah.
So to get that scapular rotation, that upper trap is moving. So passing through the top of that upper trap or trap superior is your supraclavicular nerve. When the muscle tightens up or the nerve is sensitive, the muscle is going to tighten on the nerve. Okay?
Yeah.
It's involved in shoulder pain and muscle inhibition for the muscles around the shoulder as well. So I'm going to desensitize that. I want to work on your traps and then we will reassess you.
Mm-hmm.
All right? Okay. Okay, hold for me, please. Okay, you may feel a twitch here, okay?
Mm.
I'm using a very thin needle so you don't get too much of discomfort. Now, this is your dorsal scapular nerve. This is what supplies the trap. So I'm going to stimulate it from here. You felt that twitch?
Okay.
Yeah. I'm going to stimulate it from here and then I'm going to stimulate it directly under the muscle. There we go. You good?
Yeah. Oh. Feel it until my finger.
That's okay. You are completing the circuit. You good?
Yeah.
All right, last round before we reassess you, okay?
Yeah.
Let's get you face down for me, please. You're gonna lie face down.
Ah.
One second. There we go. You're gonna hold here for me. Just drop this hand down for me, please. Great. The bed fell. The blank fell. That's okay. So this is your trap min.
Yeah.
You okay?
Yeah.
You may feel it in your hand.
Yeah, I feel.
I don't know if Claude's gonna come back, guys.
Yeah. If I come back, it's because I feel okay.
All right. Last one. All right. Lift your shoulder up for me. Great. Bring your arm back. Let's let this shoulder flare out. There we go. This is your trap mid. Again, you may feel a twitcher. There we go. So, see guys, a lot of the areas where Claude is sensitive, we've seen twitch responses. This is a good indication for us. It tells us that we're working on the right areas. There we go. Nice big stimulation. Done. Relax for me. Okay, let's get you to sit. You okay? You in
Yes.
one piece?
No problem.
All right. So let's reassess, okay? Abduction was your biggest issue. Let's straighten the arm. Let's lift up for me. As high as you can go. Go, go, go. There we go.
Yeah.
Much better.
Yeah.
Okay?
Definitely.
Tell me if you get any pain in range of motion now. Up for me.
No pain, I don't have pain.
Nothing. Go, 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 go. Great. Look at that.
No, I don't.
That's quite good. You're almost at full range.
Yeah.
Let's compare it to this side. Up for me. Basically, it's more or less the same now. Okay?
Yeah.
Let's go external rotation. Keep your elbow tucked in. Turn your wrist out as far as you can go. Go, 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 go. There we go.
Yeah.
Much better.
Yeah.
Okay?
I can feel it.
All right. Straighten your arm for me. Push back. Push, 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 push. Feel the difference?
Oh yeah. Before I was.
Yes. Let's get this arm up. Up, up, up for me. There we go. Right. Push back for me. Back, 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 back. Push, push, push. Hard as you can. Great.
Yeah. Before it was sleep.
Yes.
Yeah.
Okay.
Definitely.
Here.
Yeah.
Hold for me. Push up. Feel the difference? Yeah. Relax.
And I'm very sensitive. I mean, small
Yes.
things. Whew.
Wrist back towards me. Great.
Yeah.
All right. On your back for me, let's test the last two muscles on your back, please. All right. Push your wrist towards your hip. Push, push, push.
I feel strong.
Yeah. Push across for me. Yeah, that way.
sorry.
Yes, go, go, go. Go, go, go.
Yeah.
Great.
No. I feel no.
How's that?
No, good.
Good?
Can feel it.
All right, let's get you to sit for me. All right. Have you been manipulated before?
Never.
Never. You want to be manipulated? You okay with it?
Yeah. No problem.
Okay, great. Okay, let's get you on your back for me, please. Go, go, go. Oh, sorry.
I thought
My
it was
apologies.
one more. It's normal.
Okay, inhale. Exhale all the way out. You good?
Yeah.
Inhale. Exhale all the way out. Oh, 1 second. Drop your head back for me, please. Okay. Bend your knees. Lift your head for me. I'll move you now. Leave your head loose. Exhale. There we go. You good?
Yeah.
Relax for me. Close your eyes for me. Bend your knees for me, please. There we go. Relax. Relax. Inhale and exhale. Relax the shoulder There we go. You good? All right.
Yeah.
So that is the end of your first chiropractic session.
I feel good.
We got a little bit of manipulation in, a little bit of electro stimulation. We were able to improve your range of motion, your strength of your shoulder. This is essentially what goes on in a treatment session with me. All right.
I feel very good.
Let our followers know where they can find you on social media.
Yeah. You can find me in the Fresh Fitness 50.
Fresh Fitness 50. You won't believe that this man is 50 years old.
52.
52 years old. Also, guys, please like and subscribe. It helps us to continue to produce content for you. We'll see you soon. Take care.
Thank you so much.
If you have any questions or suggestions on topics that you may want us to discuss, please drop them in the comments section below.